Hello, I'm Barnaby. Welcome to another HelloLife moment. This is my associate, Dr. Jeffrey Chamberlain. He's a family medicine doctor. So, you know what? It's interesting. We are in the middle of cold and flu season right now, but then there's allergies because it's spring. How are we going to tell the difference? Do I have an allergy? Do I have a cold? Let's start with allergies.
Okay. So allergies are our body's immune system being overactivated. It's actually the IgE system is designed to fight off flukes and worms and things like that. But sometimes the IgE starts recognizing and going after other things such as pollen, food proteins, and things like that, and causing allergy symptoms.
Okay, and so if you have an allergy, what would be some of the physical symptoms?
Okay. So what the IgE does is it binds the pollen. It causes a histamine release, which causes general inflammation of mucous membrane. So it can cause itchy, watery eyes or red eye. It can cause nasal congestion. It can cause a scratchy throat in the back of your throat. In our lungs, it can cause kind of increased inflammation, so causing wheezing or even asthma symptoms.
That sounds an awful lot like a cold. So, I mean, how do we tell the difference between an allergy and a cold?
That's a good point. There's a lot of similarities between the two. The cold viruses, what they do is they attack the mucous membranes in the back of our throat and in our sinuses. They cause a slightly different response, but similar. It causes inflammation. So we can get the same sort of things: runny nose, congestion, sinus pressure, irritation in the lungs, and coughing. Usually with colds, other things go along with it, more generalized body effects. So you might get a fever with the cold. You might get the generalized body aches and just feeling really cruddy with the cold. Whereas the allergies is a lot more isolated. You're feeling the symptoms from the pressure or the congestion itself.
Okay, so here in Western civilization, we've got all sorts of drugs that we throw at the colds and the allergies. Is it a worldwide problem, or are we just suffering most here in the United States specifically, or is it just something that's going around the world, having more and more allergies these days? Because everybody's complaining about them.
Yeah, with allergies, it's kind of interesting. There's been some really good epidemiological studies that show that people in developed countries get a lot more allergies than people in the third world. Same thing with asthma. There's more asthma here than there are people in Africa. And if someone moves from Africa to the United States, the longer they're here, the more likely they are to develop allergies.
Why is that?
Basically what happens, there's a thing called the hygiene theory of allergies, where our immune system is always looking for something to do or something to fight off. And so if you're in a place where there's a lot of germs, a lot of bacteria, and there's a lot of parasites that your body's constantly fighting off, it's too busy to worry about things like food or pollen. But if you're in a place where it's relatively sanitary, relatively clean, your immune system really isn't working as much as it's made to do. It starts looking for things to go after. And so what it does is it picks on the pollen, it picks on different foods, it picks on dust, and then you get allergy symptoms.
Well, I see a lot of people, with the Purell and the HEPA filters on their air filtration systems. Are we becoming just too clean a culture here in the Western civilization?
And this is a problem. This is actually a debate that people debate about this, is which is better, is to make sure we're extra clean and make sure we sanitize everything so we don't get the cold symptoms.
Mm-hmm.
Or is it better to let things go enough so we don't get really sick, but we get a little bit sick on a regular basis, and so that way it decreases the chance of us developing allergies down the road?
Interesting, isn't it? Cold lasts 7 to 14 days. Allergy every year for months on end. I think I'd go with the cold.
It's almost better in some regards. You get sicker while it's going on, but it's going to not last as long.
I'll tell you what, thanks for the good information.
You're welcome.
And I choose not to sanitize my hand after this handshake. Alrighty, that is another HelloLife moment, because we're all about supporting your healthy journey through the use of supplements and medicines. And for more information about this, you can always go to hellolife.net.